My name is Natalie Giles and I work for the Somerset Integrated Domestic Abuse Service, which is part of Knightstone. In 2014, Somerset County Council had only ever had 2 referrals that had come through from GP practices in the whole of the Somerset area. 1 in 4 women are victims of domestic abuse and 1 in 6 men are also victims. What the CCG and the NHS wanted us to do was to visit all the GP surgeries across Somerset, all 74 of them, and train up one particular member of staff to become like a domestic abuse lead within that surgery. Ideally they wanted a GP. GPs don't have the time. They have 10-minute slots with patients. They don't actually have the time for all this extra workload. And what we found was that there was always one very keen person who wanted to then be the lead worker on that role. So usually it was a receptionist or a healthcare assistant or a practice nurse that actually was happy to take on that role. They would get some very, very in-depth training and would then be able to go on and train their staff. I can't believe how well it's gone. As of the end of December 2015, we've had 33 referrals from GP surgeries. We've had referrals from them for parents that are being abused by their older children. We had a lady come into our refuge service that was in her 70s that had just one day been to her GP and just said, I've had enough, and he'd gone, here's our phone number. She phoned and we got her out of the situation she was in. The funding that we had was only for 1 year, but Knightstone have taken my post and made it permanent so that we can now continue the work because it's just been so positive. It's taken on a life of its own really. I'm amazed on a personal level how well it's gone.